Okay, so tell me a little bit about yourself and how you got involved in the physical therapy realm.
So I got involved in PT when I was 15. I went for physical therapy. I had knee issues as a softball player. Um, and I really found it to be interesting, but never really occurred to me to actually be a physical therapist. So when I went to college, I wanted to be a sports psychologist, and started on that route. And through a lot of major changes and program changes, I ended up in an exercise science major, and some decisions on what I wanted to do. And I kind of landed on physical therapy probably like my junior year of college. Um, and I graduated with an exercise science major. I applied for a couple programs. I ended up taking a year off, and working in a physical therapy office that specializes in patients with multiple sclerosis. And I did that for about a year and a half. And then I got into PT school in 2013. Um, and I loved it. I really enjoy the helping people aspect, yes, but I really enjoy the moving your body aspect as well, and teaching patients how it's beneficial to move their body and in ways that can really benefit them, and hopefully ease their pain and improve their function. It's really uh it's an interesting field. I'm really interested in science and muscles and how the body moves and how it stays healthy. So it's been good. I've been a physical therapist for about 7 years now. And I'm loving it.
Mm-hmm. So tell me a little bit about your focus as a physical therapist. What's the day-to-day like?
So I work in a clinic, mostly with orthopedic patients, so a lot of post-surgical patients, a lot of just basic everyday injuries, arthritis, ankle sprains, sport injuries. But I do on occasion have patients who have suffered traumatic brain injuries, strokes, amputations. So we do have a mix of a patient population, but my focus has been more orthopedics based. And I've just recently, over the past couple of years, been treating patients with pelvic floor issues. So a lot of incontinence, constipation, pre and postpartum. So after having a baby, and things like that. So that I've been getting into, that I find really interesting.
Mm-hmm. My next question is, how do you go about addressing an individual's needs? Because you work with a lot of patients in a lot of different areas. So, like,
Sure.
what sorts of things do you have to look at as a PT?
Um, so I have to look at the body as a whole. I have to look at how it's moving, the efficiency of the movement, the quality of the movement. Are they able to move at all? And if any, I guess, compensations are happening, how to fix them. So, that has to do with strength, that has to do with their range of motion, their joint mobility, and that has to do with a whole body exam. So, just watching them walk, watching them move, watching functional movements like squatting, sitting and standing up, walking, and just understanding how to fix any impairments that I might see, if they can be fixed at all, or how to teach people how to compensate for those. I don't want to call them issues, but um, deficits that they might experience, and how to get around them so they can move effectively and efficiently.
Mm-hmm. A follow-up question that I have is like, what do you do from a physical therapy perspective to make sure that individuals with disabilities have that independence and autonomy that they need in their lives?
Oh, absolutely. So I try and advocate for my patients the best that I can, whether that is ordering equipment, giving them the names of companies to order equipment, putting them in touch with vendors um, and different spokespeople that I know that can help them. I know a few prosthetists that can help them with prostheses, especially for amputations. That's really important. And and just understanding their needs. So asking questions and actually listening to the patient and what they might need. A lot of things that they might need at home, especially a big one for us is shower bars. So getting them, handholds in the shower to make sure they're not falling, raised toilet seats, walkers, canes, commodes, things like that. And we do have, I've had in the past plenty of patients in wheelchairs or needing the use of forearm crutches, and just getting them any equipment that they might need, especially in the car. That's usually a big curiosity for patients who might newly be experiencing some of the things that they're experiencing. So looking into equipment for the car and adaptations that they can use to be able to get in and out of their car safely and drive safely.
Mm-hmm. My next question is, what impact does physical therapy have on the disability community? What stories have you heard from patients that you've worked with?
Oh boy. I Oh gosh. I had a patient not that long ago who had a recent amputation, an above knee amputation, and he originally just had he had to lose his foot, and then it progressed and progressed until he lost his whole leg. And so he's been in and out of physical therapy for years now, and he is using a walker, and he tells me, the experiences that he's had in physical therapy have been really important. Just being able to get new equipment, being able to understand the equipment and how to move, and how to use his new prosthesis is really important to him. And that just makes us feel great, obviously, but it's really, for me, it's not about that. For me, it is hearing those stories and really trying to listen to the patients and their needs. And just for the most part, people are moving not in pain. People are able to move effectively and efficiently and function and maybe play with their grandkids. I've heard a lot. That's usually a big complaint when people come to us, especially older folks. They want to be able to, play with their grandkids and get on and off the floor, and that's a big one. Or returning to golf. So when patients are able to do those things and return to the activities that they wanted in the first place, that's really important to me.
Mm-hmm. My last question is, how can physical therapy create better outcomes for people with disabilities in the long run?
Um, I think just seeing every patient as an individual is very important. So everyone's going to be different. Even though they're coming in with the same diagnosis, their needs are going to be different. So I think just really being able to listen to patients and taking the time to understand what they need, um, and advocating for that, and really really pushing for those things if they're if we're able to. I think really with the disability community, I think it's big on understanding, what equipment people might need and what, if at all, and helping them to, whether it's equipment or no equipment, what allowing them to move efficiently and effectively through their home, through their community, and able to do it safely. Because that's all we want for everybody, is to be able to function as normally as they possibly can and be as independent as they possibly can, because that's all anyone wants, is to be able to, care for themselves and or others in the best way that they know how.
Mm-hmm. Yep.